Hello, and welcome back to my YouTube channel. I'm glad you decided to join me again for another informative video. Today we're going to talk about a new kind of insulin called Icodec. Have you ever heard of this new type of insulin for type 2 diabetes? It's called insulin Icodec, spelled I-C-O-D-E-C. Icodec is an ultra-long-acting insulin that only requires dosing by subcutaneous, meaning under the skin, injection once per week. It's what's known as a basal, that's spelled B-A-S-A-L, insulin, which means that it's designed to provide a relatively steady background amount of insulin in the body for an entire week in the case of Icodec. Previous studies have shown that Icodec controls glycosylated hemoglobin, otherwise known as hemoglobin A1C, as effectively as insulins that are dosed once daily in combination with other measures to control diabetes, such as weight and diet control. Hemoglobin A1C is one of the main laboratory measurements used to monitor diabetes, and it gives an indication of how blood sugar levels have averaged over the previous 3 months. Based on data from previous clinical trials, the drug's developer, Novo Nordisk, submitted a request for approval of the drug to the United States Food and Drug Administration in April 2023 for once-weekly insulin Icodec dosing for the treatment of diabetes. A decision from the FDA is anticipated by the drug's manufacturer in around April of 2024. If the FDA approves Icodec, this will be the first and only once-weekly basal insulin option for adults with diabetes type 2. Let's talk now about the most recent study in the medical literature about Icodec. The September 26, 2023 issue of the medical journal Annals of Internal Medicine released the latest study results about Icodec. The study involved 176 study locations in 7 countries and studied 1,085 people with type 2 diabetes who had never taken insulin. The study concluded, and I quote, "Compared with OD, meaning once daily, analogs, Icodec with AP showed superior hemoglobin A1C reduction and improved treatment satisfaction and compliance with similarly low hypoglycemia rates." Closed quote. Finally, let's talk about some additional factors to consider. Other than for possible episodes of mild hypoglycemia, once-weekly Icodec may be a viable alternative treatment for patients with type 2 diabetes who want to potentially convert from daily to weekly insulin injections. If the United States FDA approves this drug, it will be under patent protection, meaning that no generics can be sold in the United States for a number of years at the earliest. This could result in higher pricing that might limit access for patients depending on their particular insurance coverage and other financial issues. It's also important to remember that even with Icodec, certain individuals may require additional insulin injections. Sometimes, diabetes type 2 control requires short or intermediate acting insulins in addition to the longer acting insulins, such as Icodec or the currently widely available 24-hour acting insulins. I hope you found this information helpful and interesting. As always, check with your own healthcare provider to determine which tests and treatments, if any, are appropriate for your specific circumstances. Thanks very much for watching and listening. And until the next video, stay healthy.